We think a heart attack is sudden, crushing chest pain, that classic Hollywood scene. But up to 45% of all heart attacks are silent, happening without that obvious signal. Silent does not mean harmless. These attacks cause severe, permanent damage to your heart muscle. A silent heart attack triples your risk of dying from heart disease. The stakes are immense. Here we will uncover the subtle warnings most people dismiss as just aging and show you what to watch for. So what are these overlooked signs? It begins with a dangerous pattern of misinterpretation. Cardiologists see a constant stream of patients who mistook cardiac warnings for indigestion, flu, or muscle strain. The next myth to shatter is the sudden onset idea. Critical warnings can build gradually over weeks, even months. A primary sign, particularly in women, is profound fatigue. This is an overwhelming exhaustion that rest won't fix. Or perhaps you're breathless after simple tasks, like carrying groceries. This signals your heart is struggling to pump. Notice new swelling in your legs or ankles? This can be fluid retention from a heart that isn't circulating blood properly. Why are these symptoms so quiet? The answer starts deep inside your arteries, where a problem grows for years. Atherosclerosis, or plaque buildup, is the root cause. So if arteries are closing, why doesn't your body send clear pain signals? One reason is aging itself. As we get older, our perception of pain can become duller. The body's alarm system is less sensitive. For people with diabetes, the risk is magnified. Nerve damage can blunt or totally mask the classic chest pain warnings. Adding to the confusion, symptoms often wax and wane. They appear, then vanish, convincing you it was nothing serious. Now that we know why signs are missed, let's pinpoint what they actually feel like. These are the warnings you can't afford to ignore. Pain can appear anywhere in the upper body. Watch for new discomfort in your jaw, neck, back, or shoulders. It can mimic a stomach issue. Nausea or indigestion, especially in women, may be a cardiac red flag. Feeling suddenly dizzy or lightheaded? It could mean your brain isn't receiving enough oxygen-rich blood from the heart. Breaking out in a cold sweat with no exertion is another distress signal from your body that should not be overlooked. Jaw, back, stomach, head, skin. The warnings can appear almost anywhere. The pattern is a new symptom without a clear cause. These atypical symptoms are not experienced equally. Women are far more likely to have fatigue, nausea, and shortness of breath. Because these feelings mirror daily stress, women often delay seeking help, raising their risk for worse outcomes. Recall how diabetes can alter nerve pain? For this high-risk group, this entire list of symptoms becomes even quieter. Picture an older woman with diabetes. Her risk is compounded. She is predisposed to atypical symptoms her body may not register as intense. So let's connect the dots. How does this all escalate into a silent, life-altering cardiac event? We asked why the body fails to send clear signals. The answer, a perfect storm of silently growing plaque and a pain perception dulled by age or disease. That shocking 45% silent figure is composed of people attributing fatigue, breathlessness, and aches to just getting older. The slow, creeping arrival of these deceptive symptoms offers the perfect camouflage. They are rationalized away as normal life. The clear conclusion, the greatest cardiac danger isn't the sudden event, but the gradual accumulation of changes we are taught to ignore. The single most valuable takeaway is this: listen to your body's whispers before they are forced to become a scream. Ignoring these signs leads to more heart damage and triples your mortality risk. The stakes are simply too high to be dismissive. The new rule is this: if you feel a new, persistent symptom without a clear reason, don't write it off. Talk to your doctor. Knowing these signs is a form of power. Share this video with someone you care about. It could help them save their own life.